Hi guys, welcome back. It's Dr. Saru. I hope you had a fantastic week. I did. And today we have a new interesting video. As usual, I've seen there's a lot of myth surrounding this whole topic. And so today we're going to talk about it and see how much of it you actually knew it was true or it was false about. So yeah, first things first. What we're going to talk about today is vulvovaginal candidiasis. Ever wondered what this can be when you see it on your panties? Tune in today because I'm going to be teaching you guys about vaginal candidiasis or vulvovaginal candidiasis or yeast infection or fungal infection or whatever you'd like to call it. So I'll give it a brief run around. So basically what you normally notice, one of the most cardinal signs is something thick like this, white, yeah, and it's normally in most cases card like, yeah, ama unaweza kuona inakaa kama maziwa mala. You can see how it looks like. Yes, and this is not the actual discharge that comes out, so don't worry about me touching it with my fingers. So basically this is how it presents itself, what is commonly known as fungal infection or yeast infection. One of the first things before I go in, I'd like to address a few questions that I have found out or have been brought forth before or concerning the same topic. So the first question that I want to answer that has been frequently asked is it sexually transmitted? No, mainly because we all have candida in us everywhere, yeah, like the way we have so many other viruses and bacteria just around us, or rather not viruses, mainly bacteria around us, yeah, on and in our bodies. So what normally happens is when there's pH change in a woman, either brought about by hormonal changes when it's between or it's about to be that time of the month, or periods just ended, or whatever it is, the hormonal change that is brought about can bring about change in pH, and in most cases that helps thriving of the candida or the fungal infection. I'll tell you the risk factors that are involved into getting repeated that one off time you got the candida. So let's jump right in and talk about vulvovaginal candidiasis. So you realize I already gave it a name, vulvovaginal candidiasis. What does this thing mean? What is vulvovaginal candidiasis? It's a fungal infection that is brought about by fungi called albicanis, Candida albicans. So basically that is the fungus that is responsible for that fungal infection. In some cases, there are people who get other fungal infections that are not necessarily brought about by candida. Of course, now we're not going to be discussing those. So what are the common presentation, or what would lead you to think that you have a fungal infection or candidiasis? One, it is the itch. It is so bad that you'd want to rip off your pads because it gets really itchy. So I find most people confusing sometimes between UTI and candidiasis. Not when you're getting an itch, it's a UTI in most cases. It's normally accompanied by that thick card-like discharge, vaginal discharge that comes along with. So number one is the itch. Number two is the thick white card-like discharge. Discharge is normally non-foul smelling. It normally doesn't have a very bad stench. It's normally almost like the usual normal discharge, only that this time you find it in large amounts. So it's not going to be just a few drops here and there, it's going to be in large amounts in most cases. So what are the risk factors that can lead you to get this infection? Of course, I already told you having a hormonal change or having pH change can lead to this infection to happen. So one of the most commonest risk factors is pregnancy. So you tend to realize when a woman is pregnant, they get recurrent UTIs, or even if they're not recurrent, but they keep getting UTIs. And then the other thing is also candidiasis. So risk factor number 1, pregnancy. Number 2, if you're suffering from high sugar levels or you're diabetic, you find out that you get to have candidiasis repeatedly. This is because in most cases, or in all cases, fungal infection thrive in an environment which is sugary. So when you're having uncontrolled diabetes, or you keep having your sugars all the time spiked up, you tend to have you have a risk factor for getting candida. The third thing that is also a risk factor, if you have been on either immunosuppressants, or you have a condition that is suppressing your immunity. What I mean by that, if there are medications which we prescribe sometimes which tend to suppress one's immunity, i.e. steroids. In some cases, you find that somebody has been on long-term steroids for whatever reason that the doctor is managing, so they keep having recurrent candidiasis, and you're wondering, oh, but I've been treating this all the time, why does it keep coming all the time? This is one of the reasons, or one of the risk factors that are listed above. That if you're on any immunosuppressive therapy, could it be chemotherapy, as I said, steroid therapy, or the other therapy that could be suppressing immunity? Yes, I already mentioned chemo. Yeah, so for whatever therapy that is suppressing your immunity, you tend to have those flares, or rather you tend to have those infections repeatedly. The other thing, if you've been using antibiotics, or you're on a course of antibiotics, you notice sometimes for some women, they tend to get candidiasis when they're on antibiotic therapy. This is very simple. It's because the antibiotics do not only just kill the bad bacteria only, but they also kill the good ones, of which now again the pH balance and all that sequelae happens. Yeah, so we have already discussed pregnancy, say immunosuppressant condition, or immunosuppressive therapy. For immunosuppressive conditions such as HIV, cancer, or some chronic ailments like now diabetes, as I had already mentioned earlier, can also put you in a position where you keep having this infection almost all the time. Also for some the elderly ladies. So in most cases, when you find yourself having recurrent infections, it's good for your doctor to go in other than just self-prescribed medication. And of course, we do a series of tests so that we confirm that it's actually candidiasis, or maybe it could be some other fungal infection, or whatever it is, and also so that we can give you the appropriate treatment for it. So now you ask yourself, what are the treatment options out there now that you know how it presents? What are the risk factors that are involved? What are the treatment options available? So for our treatment options, there is the tab, like the one you're seeing above, and then there is the pessary. What this is not a tablet, or it's not a pill. So you basically use it to insert it into your vagina. This is a pessary. It's a soft capsule pessary. So you usually just insert it through your vagina, normally once daily for 3 days. But depending on how severe your infection and how you've discussed with your doctor, they're going to explain further on how you do it. And then there's a gel. This has miconazole and metronidazole. I forgot to tell you the pessary was clotrimazole. So those are types of antifungals. So for this, it normally comes with an applicator, because you can't insert the gel itself. So basically what happens, you tie the applicator like that to the cock, and then you push it. There's a line there where you see. So basically after you've taken the amount that is required, you can see it here. This is how the gel looks like when you push it out. And in most cases, we prefer not to do the oral antifungal, especially if it's not a complicated infection and it's very, it's not even been recurrent, and you don't find the need for the oral as much as it's just a start dose. We normally prefer either pessaries or the vaginal gels, of which I have elaborated well enough on how we can use this particular medication. Please, if it's your first time getting this, it's good that you go explain to your doctor first, and this should not be substituted for medical advice. It's good that you go to your hospital and actually get checked so that your doctor can be able to prescribe what they feel is good for you. Again, don't be embarrassed about that itch. Everybody gets it at least once in their lifetime, because it's the most commonest it's one of the common infections, vaginal infections, that women suffer from, and especially when you're pregnant. So ladies, enjoy. Until next time, love and love.